Hi everyone, welcome to the 15th episode of Dose of Derm, a dermatology guide for medical students. My name is Emma Holjak.
And my name is Iryna Savinova, and on today's episode, we will be interviewing Dr. Dimitra Bednar, a second-year dermatology resident at the University of Toronto.
She received her MD and master's degree in health research methodology from McMaster University. Dr. Bednar's academic interests include dermatology and connective tissue disease, malignancy, and systemic therapies. She enjoys writing for patient audiences and mentoring people with interests in medicine and dermatology. Outside of medicine, she enjoys an energizing Pilates class, exploring the food and art scene of Toronto. Without further ado, we are excited to introduce to you Dr. Bednar.
Hi there. Hi, Emma. Hi, Iryna. Thanks for that warm introduction.
Thank you so much for agreeing to join us on our podcast. We're really excited to hear a little bit more about your own story and journey in dermatology. So if you're ready, why don't we jump into our first question, which is maybe whether you can share a little bit more about your own path to finding dermatology and kind of how you decided to pursue it.
Yeah, absolutely. And I just want to start off by saying, it's a pleasure to be invited. I see that I'm in great company of other people who have joined your podcast. And I think this is a really cool initiative that both of you have taken on. So terrific job. But I'll get back to your question. So my story and path to derm was a little bit different than a lot of the people I applied with, which I think in the end kind of helped me stand out. So I went to McMaster for medical school. It's a 3-year program. And because of my graduate studies and undergrad and just like my personal interests, I started med school thinking I wanted to do pediatric neurology, which now, like knowing what I know, is so funny. So in my first year at Mac, I did I shadowed virtually every specialty. While I was doing that, I would keep a little notebook with me, sometimes to record like cool cases and things I learned, but also to kind of take observations about like, did the staff seem to enjoy their day-to-day? How did the residents look? Did they seem happy? And like, what were the working relationships? All those kinds of like little nuanced things. So by the time I was, done my first year at Mac, because it's an accelerated program, I think I had done like a little bit of shadowing of virtually everything. And at that point I decided, I kind of liked the OR. I liked working with my hands. I liked seeing like a finished product with my work. And I tended to like get along well with the surgical residents and the staff there. So I had started planning all my electives and I was gearing up to, apply for a surgical specialty, and I had done a lot of research and worked with like my peers on projects like that. And then we had the pandemic, which had a lot of scheduling conflicts. And for my year, we were like pulled from clerkship for a couple of months there. And just by chance, I got a rotation in dermatology about September or October of my 3rd year in medical school. And I literally thought like, oh, this will be chill, the hours will be good, and I can work on my CARMS application. Because I think my CARMS application would have been done like December, a couple months after. I literally didn't prepare a thing. I didn't even review my basic morphology, nothing. But I showed up and I had such a great first day. Like I'll never forget just, how much I enjoyed being in clinic, seeing the variety of presentations, working with my hands, but also, building differentials and using my like internal medicine brain a little bit more than I did in other surgical specialties, at least. So I went home that first day and I was literally laughing on my way home. Like I'd had such a great time. I went home, I was so motivated to study and read about dermatology. I'd really never experienced anything like that in medical school, or really any time before. So that was a hard moment, I guess, because I realized, maybe there is something else in medicine that I like a little bit more. What am I going to do? I'm supposed to apply to residency in a couple of months. So that was when, after the rotation, I continued to do well. I think I learned a lot. I had a great relationship with my mentor. And I kind of said to him, like, this might be something I think I want to do. What do you think I should do? Here's the situation. And so he was very honest with me and said, it's looking not good this year for you to apply. But I had heard of a unique program at McMaster, the enrichment year program. I had known a couple of peers who were more senior than me who had done it and matched successfully to things that they wanted. And basically what that program allows third-year students to do at Mac is defer applying to CARMS for 1 year for reasons that are, sudden change and desired specialty. And that gave me 8 months to do research and scholarly work, and then 4 months to do electives. So I applied for that, was approved to do it, and then spent those 8 months working really hard on various research projects, preparing for electives, planning my electives, and that was that.
I am really excited we have you here because that's definitely a different story from, what we have gotten so far. And I'm so curious to hear, like, when you first kind of realized that dermatology was something you're interested in, but it was like 2 months before CARMS, like, what was going through your head? Like, how did you even have the courage to make that leap? I feel like it'd be just so jarring.
Yeah, and you know what, like in preparing for this interview, I was going through some old documents on my laptop and my phone about like ideas I'd had kind of at that time. And it was funny, my brain was very chaotic, weighing the pros and cons of, staying back a year and knowing that you can try really hard, but nothing is guaranteed, right? I know I was really fortunate actually. I have like a very supportive family. I had excellent mentors. I had an excellent guidance counselor at McMaster, people who were very supportive and encouraging of me, but also frank and honest with me that I think helped keep me grounded and able to see, not so narrowly, but see kind of big picture. And through a lot of discussion with like my friends and my family, I said to them, I'm always going to wonder if I didn't try, what would have happened or how would things be different? And I said to myself, if I try and it doesn't work out, like I'll just be proud that I tried. So that's kind of, yeah, how I got to that decision. But it was really a lot of other people in my corner saying, okay, we'll help you with this, or yes, I will mentor you. I will agree to supervise your research projects, in addition to their busy clinical loads and their scholarly work and their personal lives. So I was really fortunate that way.
It sounds like that was a very healthy mentality, kind of not worrying about how things will work out, but just trying your best and, for lack of better words, shooting your shot to see how it goes anyways.
Exactly. It sounds cliche, but cliches exist for a reason, right? There is some value and truth behind them. Yeah.
So kind of building off of that, when you did enter the match following that year you took and doing like research and extra electives and things like that, one thing we wanted to ask if you were comfortable sharing is, were you considering at all parallel planning, or were you solely interested in applying to dermatology?
Yeah. Absolutely. I did parallel plan. I parallel plan with family medicine. And that was an honest, authentic parallel plan for me. I was fortunate that my family medicine core rotation and clerkship happened like pretty late in my original clerkship. And so when I first kind of rolled through that, um, I thought to myself, oh, having seen like enough of medicine and knowing kind of what's out there, this is a specialty or a general specialty that I could see myself happy with. So I did do some electives in that as well during my enrichment year program. And I was honest with all of my preceptors, like, because they ask you all the time, what are you applying for? Oh, I'm applying for dermatology and family medicine. Because I think, and that's a personal decision, how much information you want to divulge to preceptors and all that. But I just found that the most comfortable for me, kind of easy to keep my story straight and lay out all my cards. That being said, for some people, their parallel plan or becomes the plan and the future. And so I would just caution, make sure whatever it is that you parallel plan with, if you choose to do so, it's something you really see yourself being happy with. I liked that with family medicine, you had still an outpatient experience, you had longitudinal relationships, and really there was so much you could do after a residency, whether that was an OR assist or special like women's health clinics. Just like the fact that family medicine is so broad and has so much room for change and growth in their careers, I think is really attractive. There's not really much else I can think of in medicine that is like that. Yeah.
Thank you so much for sharing. That was super interesting. And it's nice to hear kind of your thought process and how you kind of went through the process of parallel planning. And I know that'll be really useful to a lot of people, and a lot of students can probably definitely relate to that mindset and that process.
I think something else we would like to kind of hear about, because as a resident, I think you're still so close to have been going through the process that it's super helpful to kind of hear your insight on these things. So something else we were wondering is if you feel comfortable, if you could share a little bit about the activities or research that you were involved in medical school, and maybe anything interesting that you got to participate in because of that enrichment year.
Yeah, for sure. And I get this question a lot from, prospective derm applicants and even people who are thinking about applying to med school, like, what should I be doing? What looks good? And I always tell people, like, there is definitely no magic formula. I always tell people that you should do whatever activities, extracurriculars that you personally enjoy. And don't do them because you think that, oh, this will look great on my CV. There is one caveat, and I will say that I found it helpful, like, the CanMeds framework, the scholar and advocate and all that. And so I got this tip from a guidance counselor at McMaster, and what they said was, look at that because schools do use it. There's a reason they have it. And just see how you're doing on that. Like, look at that CanMeds approach, and are your activities, are your hobbies and your interests, like, are you fulfilling most of those roles? And are there any gaps that maybe you should fill? Not just for your application, but also for your personal growth and development, right? So for myself, I knew I was interested in education and mentorship and research work. So at Mac in med school, I was the vice president of academics for my class. So that role was, one of those student council roles. We met weekly, and my role responsibility was kind of sitting in on the pre-clerkship and clerkship committees and providing feedback about rotations to the staff and kind of trickling down new information from staff to the student body. During my term, we also had the independent student analysis for McMaster's MD program, which was something that they do kind of before accreditation comes up. So that was interesting. I didn't know that was going to be a job I had to do at the time, but that was really interesting. I got to work really closely with some of the administrative staff at McMaster who are all wonderful, and that was fun. In terms of mentorship, that's something I've always enjoyed, and I've definitely benefited from a lot of mentors in my life. So, they're always looking, there's always a call out, I guess, at med schools for pairing either an MD with an MD buddy or an MD buddy with maybe a pre-MD buddy. So I did both, and I'm still in contact with some of those people, and they're doing well. I find it very satisfying to do that. I took care of myself in med school. Like, I think that was a nice thing about McMaster not being so scheduled as some of the other MD programs. Like, I got to go rock climbing, and I did dragon boating and rowing out in Hamilton, and like just kind of fun stuff like that. And then research was something I'd always kind of been interested in from, I guess, undergrad and grad school, obviously. So I had a pretty heavy focus on research, both like before I knew I wanted dermatology and afterwards, of course. And I will say that because I think a lot of prospective dermatology applicants think their research needs to be only dermatology focused. And it really doesn't. Like, any research that is published with you as a principal author tells people that you can write, you can communicate, You can see a project from start to finish. You work well with others. Like that's really what they're looking for. So I think any research experience is good experience in med school.
That was really interesting to hear. And I think it really does show that you can be as diverse as you like with your activities, because it sounds like you did anything ranging from dragon boats to publishing. And I'm sure some of those publications are probably in the specialty you were initially interested in. So that was definitely interesting to get a little snapshot into your application.
Yeah, yeah. And I think, like there's nothing worse. I remember in undergrad, I had some friends and they would sign up for the course that they thought like was really easy and not going to be that difficult. But because they weren't actually interested in that class and they kind of just signed up for it because they heard it was pretty easy, they ended up not doing well in that. And that always stuck with me. I mean, your extracurriculars, you don't do for marks, but I think it's important to like spend your time how you want to spend your time. It's the most valuable thing any of us has. So just do what you enjoy. You always get a positive feeling out of that. You make new connections out of that. And that's authentic to you. And it comes across when you talk about it with other people in an interview or, in your personal letters and all that kind of stuff.
That's actually really funny that you bring that up, because I was one of those people who signed up for the food science class that everybody else said you should take. And it was the worst experience I've ever had. And it was a big learning point. And I was like, okay, never again. And I just stuck to the stuff that, even if it was a little bit harder, I knew I would do better in it, because to this day, I don't know what I took away from food science. I didn't know food science existed. So maybe that's my biggest takeaway.
Maybe. But we've all done something like that before. So it's okay. You live and learn, right?
And so the next thing that we wanted to speak with you about is we wanted to talk a little bit more about the CARMS application process. And we were wondering if you're open to sharing, if you could speak a little bit on your process and your experience writing your essays, like going about getting your recommendation letters and interviewing, anything like that.
Yes, of course. So I'm going to try to separate this into three chunks because I feel like I could talk forever about this. And you probably just don't want a monologue of me. So I'll start by saying like I am a very type A person. And so as soon as the CARMS schedule for my year was published, which I think comes out in like July or something, I like took all those dates, threw them in my calendar, made sure my calendar had alerts like on my phone and whatever. And then I made like a week before like an extra alert, like make sure that you're not missing these deadlines. And I think most people in medical school are like this, but that was just like something seemed kind of crazy at the beginning, but came really in handy because be talking to some other med students and they kind of like weren't really that prepared for things. I just remember thinking, we all know this is coming from day one of med school. They tell you about CARMs. So how, just take the opportunity and be timely and manage your time well. The other kind of first point I'll make is whatever your school offers for preparing for CARMs, I would attend. I know oftentimes those things are virtual and they're after a full day and you're in clerkship and it's probably like not the number one thing you want to do. But you have to realize the people who do those workshops do it for 100 to 200 students every year. They do have a good idea of what they're talking about. And even if you leave those workshops with like one or two little tidbits to give your application the competitive advantage, I think that is worth it. So I would go to all of those. And then in terms of writing essays, I think, at least for me, I had an idea in my head of how I wanted to frame my story. And I was kind of lucky because I sort of did have that like eureka moment of, oh, I like dermatology, I got to go for it. And so I thought in my head, I knew how I wanted to frame and organize my letters. And then I saw when a lot of the prompts came out from the programs, okay, how I was thinking of framing my story, doesn't really align with that. So number one tip is just read the prompts really carefully, really closely, and make sure that the points you're writing in your essay address their specific questions. My second point would be have your letters proofread a million times. no matter what specialty you go for, it's not very professional to have grammatical errors, spelling mistakes, etc. But also dermatologists, like most of us are perfectionists, so you're kind of expecting things to be top tier and really clean, neat, and just like, and good that way. My last point, yeah, for my letters, I had so many additions, and I was looking through them, you know, in advance before we talked. I had like 5 or 6 versions of some letters, and it was funny just to go through them and see like what changed and how did they become better over time. So don't be afraid to start, because you can always edit, but you have to start somewhere. Okay, so that's the essay part. You asked me also about like getting letters of recommendation. Yeah, I think honestly, letters of recommendation probably made the biggest difference in my application. I was really fortunate with the mentors I got to work with in Hamilton and the GTA. And I'm pretty confident that their letters are kind of what helped me stand out, probably more so than anything else I had actually done. Anytime I asked for a letter, I always had the same kind of phrase like, can I ask you for a positive, strong reference letter for this specialty? And I wanted to be very clear that it was positive and it was going to be strong. And I was mostly successful with that. Like no one ever said no to me. I always offered to send a brief CV, like a very focused, not a 6-page CV, but 1 or 2 pages CV to my preceptors who agreed to write me letters. And I would also offer them like a short, you know, half-page bullet points about things I thought I did well on the rotation. So whether or not that was teaching one morning at rounds or seeing a patient with like a really interesting presentation and building a differential about that, I always offered to do that. And some people will accept that and they might use it to write you a letter. And other people may say, oh, I don't want that, I don't need it. That's cool. But I thought that was a nice touch to help your preceptors, because they're all very busy people. I think that was all I had to say about that. Yeah. And then last point, interviewing. Gosh, yeah. Again, go to all the workshops. Like just, you might not want to do it. Just do it with your friends, do it with your classmates. Get comfortable being asked awkward questions, or just being awkward and having to take a minute and think about how you're going to answer. Obviously, you need to prepare those generic questions that you know they're going to ask you, like why dermatology? Why should we pick you? What else was I going to say? I did my interviewing from home virtually. I think that's how it is now for everybody. So I just made sure that, you know, my setup was good, my internet was good, I was ready early, all those types of little things. And I had a list of questions for the programs during my interview next to me. I tried to tailor questions specific to each program, just to show that I had done my research about them, and you know, that I was thinking critically about my future there, that kind of thing.
Thank you so much for all the tangible suggestions. I think we could even make like a little Instagram post summarizing some of those things, because a lot of
like, sorry, I was just gonna say, I hope it doesn't come across as preachy or anything, because again, obviously, like, I don't know, you know, this is what worked for me. I don't know that this works for everybody, and everyone's so different in how they do things, but this is what worked for me. And this is what I tell people when they ask me for advice, because I know it worked for me, but everyone's different. They might have other suggestions too.
No, it doesn't come across that way at all. Something that I did also want to ask was, jumping a little bit in a different direction. What is something unique about dermatology residency in general or at U of T that you didn't know before starting?
And you know, I don't have much contact with residents at other programs in dermatology, so I can't really compare U of T to anything else. But I think this is a pretty standard thing across most programs. There is so much off service in first and second year dermatology residency, which I knew before starting because it's published on the internet, and you can look and see what kind of rotations we do. You know, plastic surgery, lots of internal medicine, emergency medicine, tropical disease and infectious diseases, like lots of other kind of complementary specialties. But it's different, I think, to know that you do that, and then different to actually go through and do it. Because a lot of my, residents in other specialties, whether it's plastic surgery, orthopedics, internal medicine, even in their first year, like they spent a lot of time on their own service. So that was something unique, and maybe a little, I don't want to say challenging, but very different in our program and our specialty, I guess, relative to the others. I'll get my family members or friends texting me like photos of what's this rash, and oh, this is on my nephew's hand, like what should I do? And I have to tell people, I try to study, but I actually haven't done a lot of dermatology yet. We don't really get a ton of dermatology in our first and second years. So, yeah.
That's an interesting point to think about. Now being on the end of that though, and starting to be on service, do you are you sad about putting away your stethoscope? Kind of for good, right?
Yeah, I wondered if I was going to be sad about putting my stethoscope away. I don't feel that way necessarily. I still have it. I did have like this is my last day, at least as a doctor, providing care in the operating room. And that was kind of like, okay, see you later, all the scrubs and sterile drapes and all that kind of stuff. So that was interesting. But no, I'm really happy that that's behind me, because I'm looking forward to focusing on dermatology and studying and preparing for the rest of my career. I'm really excited about that.
It's probably a good sign because it's like another little tidbit of reassuring that you made the right choice then.
Exactly. And what I'll add on to that is like for people who are, thinking about dermatology and wanting to apply for dermatology, just remember that you're going to do a lot of internal medicine call, and you're going to be on emerge. And some programs might be a little bit different. They might have you do a block of obstetrics and that kind of thing. So as you go through medical school, never think, oh, this doesn't apply to me. Like I shouldn't bother to give it my best, or, doesn't matter if I don't maybe get what I need to get out of this rotation. Like I think that's such an easy trap to fall in, especially once you've made a decision to apply for such a competitive specialty that seems to have a narrow scope. But I would really like challenge against that. I think being a good medical student, showing up on time, being curious, and trying your best most days, it ultimately makes you a better doctor. It makes your rotations easier. You might hyperventilate less on CTU as a resident, like I did, because you realize now overnight, you're making decisions and you're doing procedures and providing scripts and stuff for patients. So just, try to kind of get the most out of every rotation you do in med school, because it will help you in your career no matter what specialty you end up in.
That's such great advice. Thank you. And kind of continuing on, speaking about your experience in residency, this might be a little bit tough because it seems like you may have just pivoted the areas that you're focused on in your residency, but we wanted to ask a little bit about what a day in the life is like for you as a resident. This could be, I guess, a day in the life like broadly, since you mentioned you're moving more towards focused dermatology now, or just kind of like an overview of your year or something like that.
Sure. Yeah. So I'll do like a brief 2 different days, because we're, in first and second year, we switch our rotations every month. So last month I was on plastic surgery. So a day in my life then, I was at a community hospital with one other junior resident. We had a good time, but it was busy. So I'd get up around 5:30, get to the hospital for 6. We'd round on our inpatients, prepare for the operating room, which, technically starts at 8, but staff are usually there earlier. So you want to make sure you're done all your rounds and all that kind of thing beforehand. And then as the dermatology resident, they kind of, they did a nice thing for me. They prioritized me in the minor procedures clinic. So that was mostly doing excisions for suspected skin cancers, but sometimes I'd be in the operating room operating on a hand, or a breast reduction and all that kind of stuff. So that could be, a really interesting day, highly variable as you see. And then depending on the day, I'd come home around 6 or 7, usually be pretty tired, eat something, and basically go to bed. Like, not much studying in there, but we can talk about an average day now. I'm on Sick Kids dermatology. And as a junior resident at Sick Kids, you don't do any dermatology call there, which is nice. So it's just clinics. Yesterday we had teaching from about 9 a.m. till 12. Some teaching was given by staff and some teaching is given by senior residents. And then we have a clinic, runs 1 to 4. We might see 20, 25 patients in there. And then, you finish your notes, make sure all your documentation is cleaned up and ready to go. Some staff may offer to do a half hour of teaching afterwards, get home around 5 or 6, eat some dinner, maybe study for an hour or two, maybe go to the gym, see a friend. And that's kind of the average day.
Okay, that sounds wonderful. And it's nice to hear that now being on Sick Kids Peds, you're kind of moving closer to the average day that it's going to be more representative of things moving forward.
Yeah, exactly. And just really excited to, go to work and kind of be working on and learning what I'm going to be studying when I get home. Like, I think that's the best way for us to learn is like see a case, learn about something and then go home and study it more in depth so that you can retain that information. And I'm really excited that now, like, most of my studying will be in that similar fashion.
So this kind of brings us to our last question before the rapid fire questions that we like to do. So we just wanted to kind of open up the space for any final piece of advice that maybe someone shared with you when you were applying that you'd like to share, or something that you've picked up along the way that you think would be helpful for our listeners to hear.
Absolutely. Some general advice when people ask me, what should I do? I'm interested in derm. And maybe I already touched on these points a little bit, but I think research is favorable. Research in derm, highly favorable. But again, any specialty is favorable. So try to get a project in medical school. It's not a bad idea. And you learn important things too about submitting to journals and that kind of thing. When you're on your electives, I think things that are really important and basic are showing up on time, being polite to every person in the clinic, administrative staff, the cleaners, the nurses. It seems very obvious and basic, but it's actually really important because a lot of those people work every day with your preceptor and they see a lot of students. So it's natural for them to talk and say, oh, so-and-so was wonderful, weren't they? Or, so-and-so wasn't so wonderful. And so just, remember that. I think on your electives, really, as a medical student, like, of course, you should be studying and preparing and have a general idea of what kind of history and physical exam is important for your patients. It doesn't matter so much that you're super well read or that you know what you're going to do with the patient afterwards, right? That's why our residency program is 5 years. But be teachable. So what I mean by that is someone, sits you down after clinic and gives you a 5 or 10-minute spiel about how to approach a patient that you think has scabies or anything like that. Like, really try to soak up that knowledge, be a sponge, take notes on your phone, whatever you have to do to show that person that, you're listening, you're paying attention, and you're curious. And then the other thing I would say is very, like, more broadly thinking about applying to any specialty when you're going through CARMs, as much as they are interviewing you, and you want to get into your specialty, to dermatology, whatever, you should remember that you need to also interview that program. I did the calculations for the average 5-year program between clinical hours and the expected time to study. you give about 20,000 hours of your time as a resident in a 5-year program to your co-residents, to the staff, to the hospitals, to the community. So just make sure that that place that you're giving all of that time to deserves to have you. That would be my last bit of advice.
That definitely puts things into perspective, eh? Like when you calculate it out like that, definitely gives some context to the advice of interviewing them as much as they're interviewing you.
Yeah. When I said 20,000 hours, I was talking about it to my partner this morning. We were both saying like, that's a lot of time. So yeah, just make sure it's a place that you're going to be happy with, that you want to work with the other residents there, that you get a feeling or an idea that they prioritize your learning over your service, because that's a really big piece as well.
So to end off the episode, we do like to ask our guests some rapid fire questions just for our listeners to get to know you a little bit outside of medicine. So if that's okay with you, we'll jump into the first question, which is, since moving to Toronto for residency, what does a perfect day in a life look like to you in the city?
Oh, I like that question. Okay, like a perfect work day for me would be being on dermatology service, number one. Getting up pretty early and maybe fitting in a fitness class before going to work. Showing up to work on time, having time maybe to have a coffee in clinic. Working in clinic with I mean, all the staff at U of T are great, but working in clinic with the staff and residents and like having my community around me. Finishing on time, which is sometimes easy in dermatology and sometimes not easy in dermatology. Finishing on time, like finishing by 5 or 6. Having time to make sure my notes were done, my studying was done, and then probably going out for dinner with my partner or some friends or my sister and brother-in-law in the city.
That sounds lovely. And just, to throw it in there, if it wasn't a work day, I'm sure
Yes.
that would be different.
Yes, if it were not a work day, that would be different. Probably have a bit of a sleep in, go to a local coffee shop with my partner and have kind of a lazy morning, maybe head to the St. Lawrence market,
Ooh.
pick up either something for lunch or something to cook for dinner, or just like get some nice flowers for our place. I'd see my sister and my nephew who's about to turn 1,
Aw.
and just kind of hang out with them for a bit. And then, yes, because it's Toronto, go out for dinner, go to a show or a concert or a comedy, just like trying to get the most out of living in the city when I can, as someone who grew up in suburbia. So just, yeah, going to shows, going to concerts, seeing what's out there.
Amazing.
The next question we had for you is, I was wondering, you mentioned previously that when you were in medical school, you had a lot of like fun sports and activities you participated in. I was wondering if you had a favorite sport or outdoor activity.
Okay. I don't think I have just one, as like lame as that is. I mean, I'm really on this Pilates run right now. I joined a gym where they do Pilates to like all these fun tracks, and it's a large community and the class is usually full of women, and I've made some nice friends there. So I really enjoy that. When I did med school at Mac, I really enjoyed like hiking the Bruce Trail and walking. There's so many beautiful places to walk and hike in Hamilton. And then probably the most satisfying thing I did was rowing, like rowing a boat with a team of 8 girls, women, I'd say at the time I was in high school and undergrad. That was just like when you are all in sync with each other and you're getting the boat to move really fast and like everything is smooth and the water's smooth. That's a really good feeling too.
I totally relate to that because I also did rowing in high school and I've done a
Yeah.
lot of sports, but yeah, there's just something about rowing that I don't know, it just kind of sticks with you and like even like the people you get to meet there, it's so fun and being on the water. Such a
Yeah, It's like, it's such a stereotype. Like there are certain people that are rowers. I don't think I could do it now because like we had to get up so early for that. Um, but yeah, I do miss it. It was a really good time.
Yeah, I agree with not probably not being able to do that or not being able to erg anymore.
Yeah,
I that's over, but look back very fondly.
exactly.
Maybe you both can put together a team in dermatology one day.
Oh, maybe. I like that. A little two-seater, some sculling, maybe. Yeah.
The derm dragons, I don't know. Just putting it out there. You don't have to pick it up.
Yeah, that's not a bad one. Durham Dragon. Okay, we'll talk later,
You'll
Emma.
think about it. Think about it. Okay. Last question. What's the most memorable place you have traveled to in the past few years?
Hmm. I would say Greece with my partner. Like I finished med school and we spent 2.5 weeks in Greece. I'm part Greek. I'd been to Greece many times before, but it was my partner's first time. And we went to some islands I'd never been to. So that was, I guess, technically new and unique for me. But it was really cool and special to see like someone else falling in love with that country and that place. And for him to get to see what I was talking about in terms of the personalities of Greek people and the food and the water. So that was really memorable. We talk about that a lot still.
That's so special. I love showing people my favorite things. Like every time I recommend a movie, I always end up watching the person more than the movie, which they don't seem to appreciate as much as I do, but I just can't help it. I love them like experiencing the things that I love.
Yeah, yeah, it's like it's so cool to see someone like kind of getting that for the first time. And I think that's probably why I enjoy doing things like this or talking to students and mentoring students because you see when like they find what they're into or they see that they can do something challenging, like they learn something new. It's always a cool moment.
Yes. Well, on that note, I wanted to say a huge thank you to Dr. Bednar for taking the time to join us today and for sharing all the little pieces of advice and insights into her journey. We are so appreciative of the time you took to speak with us today, so thank you so much. And to all our listeners, thank you for listening, and we hope that this episode gave you some more insight on applying to dermatology. If you have any feedback or if you want to keep up with our next episode, you can follow us on Instagram and Twitter at Skin Curriculum or visit our website at www.skincurriculum.com. Otherwise, we hope you enjoyed this episode of Dose of Derm, and we hope you all take care.